When I consider culture, there's no way that I can talk about culture without bringing in colonization.
Yes.
When I was born and raised and taught this is the way that we treat our family, I wasn't taught anything other than go check on your grandmother, go check on your auntie, go check on your cousins. How are they feeling today? What wasn't taught to me was that as Nagle, as a spiritual person, that we were recognized as people who participate and contribute to our community in positive ways, in more ways that I could ever teach you in this 1 hour presentation. And so when we talk about colonization and culture, it's a dichotomy almost for me, especially now in my self-retrospection and how I view the world. I recently went back home to my native family and I started asking them about Nagle and why they didn't teach me and talk to me about Nagle. And what they told me was, we only talk about Nagle if it's brought up. Growing up, I heard Nagle in the same sentence as faggot, queer, and undeserving. So in my mind, I thought, why would I bring up my cultural upbringing of Nagle when it's gonna be equated to me being a fag? And everybody hates fags. And so culture is this deep understanding to me that I want to go back to. F, the Western world, the theology, and the history of it. Because as we sit up here today on this panel, what we're bringing to you is our own history and what we need to begin learning from this point on. And we need to start breaking this cycle of respecting European knowledge. And we need to come back to our roots of here, of who we are today. I want us all to realize that healthcare goes beyond procedures. It goes beyond the medical practices of what you think trans people need. It really has to do with us as individuals and how we take care of ourselves. I abstained from alcohol for 11 years. I drink now. Some people call me drunk, whatever the hell. I smoke weed. What else do? I have sex. I have multiple partners. I smoked crystal meth before to help me with my sexploration. There are so many aspects that go into an individual's life that makes them whole. And I bring this up to you today because I've been in this community for so long, and I consider myself a leader, and I'm sure that people have considered me a leader as well. And I'm telling you this to be extremely truthful and to let you know that as service providers, as leaders, as human beings, we all do things to make ourselves feel better. Not only better about ourselves, but better about the community. And yes, there may be a line somewhere in the sand that says maybe this is too much, maybe it's not. But who is it for you to decide that? As medical providers, we do things individually for ourselves to keep us alive, to make ourselves walk out that door in the morning. And sometimes it's not having a pussy. Sometimes it's not having breasts. Sometimes it's not just taking a pill. Sometimes it's a little bit more than that. And so when we think about health access and how we deal with ourselves, we really need to delve into a lot of the emotional, mental aspects of ourselves. Not only as clients, as patients, but also as our own selves, as people who are providing these services. What do you do to make yourself feel good when you walk out of the door in the morning?
Take a deep breath first.
Colonization.
Okay.
Can I answer with just that? The reason why there is other is because as Indigenous people, we've been trying to be erased throughout history. The whole point of this is because Native philosophy does not correspond with Western philosophy. Colonizing thinking is against Native thinking. When you begin thinking as Natives, you begin thinking of community, as has been expressed on this panel since we started talking. When you think of Western philosophy, colonizing thinking, it's all about the money. And so we really need to consider what wealth means. When Maddie was talking this morning about us dwindling, no, we're being murdered. That's why our numbers have lowered from the millions to the 100s and thousands. We're being murdered. And it all has to do with what your view of wealth is. What is your goal in life? Is it to achieve money, or is it to achieve a healthy family network? So when we're otherized, that's the whole point of it. The whole point is that you do not belong here. And that is a part of Western philosophy. That is us against nature. But the truth of the matter is we are nature. We are all like trees. And there's no way that you can tell a tree that they have too many leaves, that it's too brown, too dark, too this or too that. No. We are trees. We are nature. And so when we become otherized, it's like telling a zebra you have too many stripes or not enough, because the thought process is wrong. I hope I answered that. My mind is going.
Perfectly.
My mind is going.
Do you need water? Do you need breath? Kat,
More to this. There, aside from othering, as communities of color or as communities who are marginalized, there are a number of national studies out there published by white people where the data is skewed. And it's actually quite ubiquitous. The talk is there. Nobody brings it up to the forefront. These are things that we need to look at. Why are we skewing the numbers? Why? Because we need numbers. It's done in LA, it's done on the East Coast, it's done everywhere. So what that tells me is that yes, there are people on board who are trying to raise the level of the focus onto marginalized communities, but we need to do it in a more profound, intentional way, rather than skewing numbers. We need to really outreach and begin looking at why our numbers are so low and why we continue to use the same numbers over and 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 over again. I'm tired of having the same conversation. What needs to happen from this point is, as individuals, you need to begin advocating within your own organization. I used to say change happens from the top down, but when I quit my job at AIDS Project Los Angeles, I know it starts from the bottom up. Individual, what you can do to help, if you have the information knowing that this will help a community and it is not happening in your organization, step up, advocate, and tell them. Because we're doing what we're doing because this is what we do. And once again, change happens from the bottom up. Overall, the whole presentation for me, actually my whole personal platform, is mental health. Throughout the years that I've been putting one foot in front of the other, just doing what I do, there's a lot of anxiety that exists within myself. And when I was younger, I couldn't deal with it necessarily because there's this pushback from the Native community against the white man's getting into your brain, to the white man getting into your brain. I remember when I told my mom that I was in therapy, she says, "What? The white man's just gonna brainwash you." And I didn't see it that way because I'm very introspective and it totally helped me out. I started drinking when I was young, and I realized that the reason why I started drinking is because I didn't feel a part of the world. And I was sober for 11 years. I abstained from alcohol for 11 years. Within these 11 years, I grew in a different capacity mentally. And then last year, I started smoking crystal meth sporadically because I couldn't deal with my body. So now I'm dealing with my sexuality, because what I learned from the white man is that as a trans woman, you can't use your penis. And that fucked me up. And so when I got sober, I was thinking, but wait, how do I respect myself if I can't respect my whole body? And so I used crystal meth to help my sexuality, and I started topping, and I started using all of my body, appreciating all of my body. And yes, honey, we all have to do that. And so now, like going back to what I said, there are forms that we take, there are choices that we make that make ourselves better. And I have to tell you, despite my alcoholism, despite my crystal meth use, despite my 420 use, despite my HIV status, I'm actually a better person today than I was 2 years ago. Yes, I'm still fucked up, but I know it. I know it. And it really F's me up even more as service providers distance themselves from me, because they look at me and they say, wait a minute, you're telling your truth? I can't tell my truth, you scare me. I can't be around you. It hurts. It hurts. So another challenge I give to you is tell your truth. Just a step below being a service provider and working within the transgender community, if you belong and interact communally with the transgender community, I challenge you to begin talking with the trans community. We need to become more Martin Luther King-like in our vision. We say hire trans people, but there are a lot of trans people who are hired who are incompetent. Just because you're trans doesn't make you a professional. Just because you're trans doesn't make you fit the bill. The reason why I tell you this is because I became HIV positive October 19th of last year. And as a service provider, I was ostracized. People look at me like, you should have known better. And when I was going back to receive services, the trans person who was supposed to lead me through my process was 12 years old, she was late, and she didn't give a shit about me. She was dressed to the nines, she looked like a fucking supermodel. And despite all of my experiences in this particular field, I wasn't prepared for this. And so we have to be careful when we say hire us, because you can't just hire anybody off of the street, which is why I challenge you, if you interact with the trans community, you need to start bringing them up. You need to start checking their P's and Q's and telling them, No, honey, you can't be acting like this. This is the way you act.
Okay. Time check?